Dr. Veress, if you could please share your screen and we could hear the case. Now, the way this is going to work tonight, there will be a few polls that will stop and ask your questions. I think there's 2 polls. We'll ask the audience for participation, and then we're going to try to end the presentation by about 8:15 so that we can get some discussion from the people in the audience. And also during your presentation, we'll also periodically stop and discuss with our panelists, but that'll go along with your polls. So Dr. Veress, take it away.
Thank you so much. It is an honor to be here with everybody. This is going to be redefining the watch and wait model in medicine, how to do nothing to achieve life-changing results. This is a case study of management of stage 3A, low-grade follicular lymphoma, using water-only fasting and whole food plant-based diet. A little bit about non-Hodgkin's follicular lymphoma is that, even in late stage disease, median survival rate is anywhere from 8 to 10 years. We do know that around probably 85% of the cases does have a chromosomal translocation T14/18, and it is pretty slow growing. So it's anywhere, they say less than 45% can go through histological transformations into the more aggressive diffuse large B-cell lymphoma. So this is a really good case study of how we can use nutrition and lifestyle medicine to help with the results. This particular case is about a 42-year-old female. She presented to True North Health. She interested in a prolonged water fast for her recent diagnosis. Right around 2014, she had been checking out some tenderness in her pelvic region. She did report that due to a hysterectomy back in 2012, she was intermittently having some tenderness in that region. So she had, on occasion, done some palpation, and on this particular day, when she was palpating, she felt a mass in that right inguinal region. She went in and contacted her PCP on 6/23/2014. During this time, she denied she did not have any fatigue, no fever. She didn't have greater than 10% weight loss. There was no malaise, no night sweating, so really no associated symptoms whatsoever. Besides the hysterectomy and the bladder surgery that I mentioned back in 2012, she did have carpal tunnel surgery back in 2005. And then her most concerning was the hyperlipidemia and also allergies, so just rhinitis, which she was taking Allegra and Zyrtec for intermittently. She has no known allergies. At this time, she was on a very much standard American diet. No real history of tobacco use, of any sort of drug use. She's really not a drinker. She maybe has up to 3 drinks a week, but usually will go periods of time with not even drinking at all. She is married with 3 children, hence why she did have the hysterectomy and bladder suspension back in 2012 because of incontinence after the 3rd child. And then she did, though, report quite a high level of stress. She is an executive assistant still to this day for a very high level corporate leader in the Chevron industry. When we talked to her, she did not go to oil rigs, so she was never in the actual fields. She was more in the office, but it was a pretty high stress, high powered position. She did have a father that did die from cancer of unknown origin. When we were speaking to her, they diagnosed it as lung cancer, but when they found actually the spread of the disease, it was so late stage that they really were unsure about the origin. So it was kind of termed cancer of unknown origin. And then she does have paternal relatives with history of renal cancer. At the findings of the right inguinal mass, the PCP actually sent her for a CT scan, which did find actually bilateral enlargement of the inguinal lymph nodes. And this CT scan was compared and was able to be compared to the CT scan from 2012 that she had done. The right inguinal region measured 45 by 20 millimeters. The left inguinal region measured 21 by 15 millimeters. Thankfully, there was no iliac chain lymph node enlargement, and there was no evidence of free fluid in the pelvic region. She did undergo some serological testing. The CBC was unremarkable. She was actually referred over to an oncology team. At that point, they did do a biopsy of the left inguinal lymph nodes, which was done a month later. And that did actually have the diagnosis of the non-Hodgkin's follicular lymphoma, because they did find the CD positive monotypic B cell on that biopsy. She was later scheduled for a CT scan where they did find enlargement of the right axillary lymph node and the measurement was 28 by 19 millimeters, which as we know, because it's both sides of the diaphragm, that's where the stage 3 comes into play for that. So first discussion that we have is, what is at this stage of the game? We have stage 3, we have asymptomatic patient. What would be the standard medical care next steps? And what would be the appropriate next step care in her management if we're looking at this in a little bit differently with the lens of a lifestyle medicine approach? What is the basis of the recommendation? And also, is there any other lab work that might help us with the management of the care that maybe wasn't brought up?
So is this time for our first poll?
This is a discussion.
Oh, discussion. Okay. Yeah. Dr. Breakey.
The things in her favor, of course, relatively young age and a normal CBC. She does have relatively both-sided lymph node involvement. And of course, as a family physician, I would rely on my hematology oncology colleagues to give us a sense of standard care. She's indicated for treatment. And my understanding is there are prognostic factors that can help to define whether she would get to that, and maybe you're getting to that. But as a lifestyle medicine doc, I would say, boy, in any case, when you're facing a serious illness like this, you want to fine tune your lifestyle, look at stress management, nutrition, sleep, exercise, and connectedness. And again, I'm sure we'll cycle back around to that. But my initial response is clearly a serious illness that we need to address head on.
Sure. Thank you. Dr. Klaper, your thoughts?
Well, my comments here are going to be a little bit biased, I suppose, because I happen to be the attending physician at True North when this patient came in, and I'm aware how the story went. But beyond that, you want to get this. It's a condition, the lymph nodes, underwent this hypertrophic malignant change, and what might have set that off. There's a question about viruses. I want to make sure her food that's flowing through those tissues are as calming and stabilizing as possible. I would yank out the oils and the sugars, and I'd get her on a whole food plant-based diet. She apparently is not there at this point. But for reasons I'm sure Dr. Veress will talk about why that's going to be beneficial, or IGF-1 levels and all that. So I'd work on her diet specifically. Dr. Breakey already touched on that, and I'm just be filling that in. And she turns out to be a great candidate for water-only fast. And so I will step back at this point and see how the story progresses.
All right. Dr. Goldhamer, could you please comment? I know you know this case very well. And a question already popped up in the chat about, did she have an oncology consult? And if so, what did they recommend?
Yeah, so originally her family physician had advised her on a watch and wait protocol. She queried the family physician originally about whether there's anything she could do that might help her. And he assured her when she asked about diet, that diet had nothing to do with lymphoma. There was no diet to treat lymphoma. When she queried him about fasting, I believe he described that as criminal quackery. So they were not supportive at that point. She did end up going to the oncologist at our local medical school on his referral at the point where he felt like it had continued to progress for a couple of years. And so he felt like that it warranted now more aggressive intervention. So she sent him to the oncologist, who also told her that diet was irrelevant when it came to managing this particular condition, and didn't think that fasting had any relevancy at all. Fortunately, despite that tremendous medical support, she decided to undergo conservative care with us in any case.
Sure. But is it my understanding that conventional oncology care for her at this point would be watchful waiting?
It had been for the first couple of years. After, I believe it was about 24 months, they had recommended she go to the oncologist for further determination about treatment.
Okay, so this is considered a low-level tumor that you don't ordinarily get aggressive with right away.
At the time that she saw the oncologist, though, he was recommending chemotherapeutic intervention.
Okay.
So, but it had been going on for a couple of years before she saw him.
Got it. Okay, great. Thank you. Dr. Veress, continue, please.
So a patient was, as Dr. Goldhamer mentioned, advised to do a watch and wait approach with 3-month interval follow-ups. At this juncture, she did come to True North and chose to do a water-only fast during that period of time. In between the time of deciding that, she did switch her diet already to plant-based foods, salt, sugar, oil-free. Her fast began on November 3rd, 2014. So patient completed a 21-day water-only fast. She came in for a little bit of a shorter fast, but did so well that we extended it to 21 days. This includes at True North, complete abstinence of food and drink except for distilled water. We usually recommend anywhere from 40 ounces to 96 ounces daily, depending upon the person and hydration needs. We always do recommend patients restrict their activities during this time. We really, if people are going to do any kind of activities, we really want things that would drive more the parasympathetic nervous system response. So things like meditation, reading, sitting, right? Do the art of doing nothing, puzzles, things like that. We do encourage individuals to do very light movement, light walking, and that's more for circulation, more for lymphatic flow. We do have educational lectures, usually 2 a day, that really talk about the importance of nutritional and lifestyle approaches, not just for what they can, do, not even just with what water fasting can do, but also what they can do after they leave True North. The patient is monitored twice a day, and that is usually in the morning and in the afternoon. They also have 24-hour, 7-day care that they can access at any point in time throughout the day. The vitals that are taken are daily weight. We test blood pressure. We also do pulse rate and temperature. Upon starting a water fast, individuals are really required to have at least a CBC, CMP, a complete blood count with diff, and a comprehensive metabolic panel at the start. If they have other lab work that is very much relevant to their case, of course, we do recommend that, and we do look at that. While they are fasting, we do 7-day intervals of blood work and urine analysis. So with urine analysis, we are looking for, as you know, with those region strips, they are not diagnostic in nature, but they can give us indications of where we might need to shift with a patient. So we can assess whether or not there is leukocytes, nitrates, so infections. We can assess if there's any kidney involvement with protein or blood in the urine. We can assess any kind of liver involvement with urobilirubin, bilirubin, and then specific gravity, we can really test for hydration levels, and of course ketones, just to make sure people are actually water fasting when they say they are, so that's always important. And then what we do with blood work is we do a complete blood count with a differential. And that really is looking for, again, any sort of anemia that crops up, right? Then we're thinking, is there any sort of internal bleeding that we just didn't know about prior to, or that we can pick up while they're fasting? If there's any cytopenias that come up, any kind of changes there. Also, we can look for hemoconcentration, so that can tell us about any kind of hydration factors that happens during a water fast. So anything that is bone marrow related with the CBC. The comprehensive metabolic panel what we look for is any sort of electrolyte changes. So of course we have ranges that we do not want to drop below because it can be dangerous to individuals. So we're watching that very closely, sodium, potassium, chloride, calcium, and in some cases, phosphorus and magnesium as well. We are also looking for kidney function. So we also have parameters for that. We do not want to take somebody into a state of kidney hypofunctioning that is dangerous to their case, right? So we're watching that. And then of course, we're watching for all functions of liver. So we're watching for not only proteins, albumin, globulin, but we're also looking for bilirubin. And then of course, the AST, ALT, ALK phos. And for her stay, her lab work was really good and steady for the entire time. So she never went into any sort of cytopenias, never had any implications. She did start off with a little bit of a higher bilirubin, which was stayed pretty consistent, but that was the only change for her, or the only abnormal function for her. She did complete a 21-day water fast. Afterwards, she did initiate a refeeding schedule. At True North, usually patients are put on a refeeding that is half the amount of time that they fast for. For her specifically, for the patient, she did on day 1, 12 ounces of an unsalted vegetable broth. She received that 4 times a day. We usually do 9, 12, 3, and 5 p.m. delivery times for that to give people enough time to be able to digest. Day 2, we usually do a really simple green juice, as we know that really decreases the fiber, so people are able to really start up their digestive enzymes and digestive juices, but also doesn't put too much stress on the digestive system. It starts to bring back in glucose utilization. The green juices are delivered at the same time, so 9, 12, 3, and 5. The green juices she received, which do change with the patient. For her, it was a mixture of celery, zucchini, and cucumber. And then also she did have a little apple in her juices as well. Day 3, day 4, she started incorporating more raw, fresh vegetables and fruit. Days 4, days 5, we started to increase the complexity by getting more, not only steamed vegetables, but also higher starchy vegetables in there. Days 6, 7, we incorporated more grains in smaller amounts, and you build based upon appetite. And then days 8 and 9, we incorporated more legumes or beans. And then finally, we start getting in more of the nuts and seeds, or the healthy fats at small amounts. So everything in True North is whole food and exclusively plant-based, of course, and no salt, no sugar, no oil. At the end, we did recommend that she stay exclusively on the whole food plant-based SOS-free diet, and she did comply. On her water fast, this particular one, she reduced her weight from the start from 78 kilograms, which was a BMI of 28.62. Her height is 5'5". To 68, and also BMI of 25.29 at the end of her fast. Her lab work, like I mentioned, stayed really unremarkable. She was able to follow up with her oncology team. So in January of that next year, she not only complied with the diet, she also lost a little bit more weight. As you can see, her BMI was 23.13, so she lost quite a bit. Lymph nodes were non-palpable at that time. On the follow-up CT scan that she did of March of 2015, we noticed quite a change. So we noticed the right inguinal node from 45 to 20 millimeters in that 2014 CT went down to 26.3 millimeters. The left inguinal node went from 21/15 to 11/2 millimeters. And then the right axillary node went from 28/19 to 15/10, which is really, really powerful. And so these are just the images. You can actually see the CT scans. We have a little arrow showing where the lymph node enlargement was before fasting. And then after fasting, this is the right inguinal region. Then the next, we do have the left inguinal region. So you can see the changes there before fasting and then after fasting. In the 9-month follow-up, this was in August of 2015, she actually stayed very true to the whole food plant-based SOS-free diet. She lost even more weight. She went down to 59.9 kilograms, which was a BMI of 2196 from the 23 before. Her lymph nodes remain non-palpable, and fantastically, her PET CT scan on December of 2016 actually showed no evidence of the active disease state. And so at that point in time, because of those distinct changes, her oncology team actually recommended a follow-up in a year. So changed the recommendations from 3 months to a year. So this is the first poll for everybody. So give a little explanation as why might exclusively whole food plant-based diet that is SOS free work in this type of situation. So why does a no salt, no sugar, no oil? Why does no animal meat? Why is there no dairy, no refined processed foods? Why are all those beneficial in this case? Or no alcohol, no coffee?
So there you go.
Are you seeing the result?
Yes.
Okay.
So the poll is closed. So what do we think about the answers?
So I love it. So I think that there is, all of them are correct, right? So this is kind of one of those, maybe not trick questions, but just it's all of them have a place, but definitely the no animal protein has the most relevance. So with salt, one of the things that we know, not only the impact that it has on arterial wall stiffening, right, is that with newer research, especially with MS, we have a drive of Th17 and M1 macrophage, which is pro-inflammatory. So there's a component there that could be impactful. We know with sugar and refined carbohydrates, we know about ages, right? And that's very pro-inflammatory. So there is an impact there. As Dr. Klaper mentioned, with oils, definitely, we want to have, good blood flow to tissues. Also, we know concentrated oil does drive more of the leukotriene, prostaglandin 2, more pro-inflammatory type of pathways. Alcohol, we just know that is a known toxin across the board, especially depending upon how the liver is able to process that in individuals. Coffee, in certain cases, can contain acrylamide, and that's a probable carcinogen. And then animal meat and dairy, I think everybody has, so not only the hormones that are involved in it, it does increase, and as Dr. Klaper mentioned, it does increase IGF-1. There's a microbiome disruption that we know from the recent work that we're doing with microbiome studies, omega-6 pro-inflammatory pathways. I mean, there's many, mercury in fish could be a component. So I think everybody got that poll very well. And then the next poll we have, if the slide is going to move. Oh, so why might water only fasting work in this type of situation? So that's the next poll.
We've got Dr. Berkowitz in the audience, always with the wise guy questions. All right, I think we're pretty close to closing that poll. There we go, great. So, Dr. Veress.
Yes. Fantastic. So again, that one was more of a kind of just mind teaser because all of those answers are correct. And let me see if I can, there we go. So through the research that we've been able to look at, there is a reduction in IGF-1, especially with more prolonged water fasts like what this 42-year-old patient did complete. There's absolutely a promotion of ketogenesis. Obviously, somebody gets into with water fasting that does have protective effects, especially as it's breaking down mostly those triglycerides. There's a decrease in oxidative stress and inflammation, which can definitely go into helping the cellular matrix of the body or the cells of the body work better. So there's less potential DNA damage that happens. There's an increase in stress response, which protects the cells from DNA damage, suppressing cell growth. It can absolutely enhance apoptosis of damaged cells, which is one of the kind of characterizing features, especially of follicular lymphoma, right? Is that there is a specific gene that does actually block the apoptosis. And then there's a breakdown, obviously, of lipids, autophagy, where you're having cellular sort of cleanup that's upregulated. And there's a decreased rates of cellular proliferation, apoptosis, like I mentioned before, but that's more due to hormonal and growth factor modulation. And then through decreasing leptin levels, you do have the stimulation of tumor regression. So those are all definitely things that have been studied through research along the way. Follow-up care. So patient actually did return to True North for a follow-up water fast in November of 2017. She actually reported just for continuation of the health benefits she's already received. This time she did do a 19 days of total water, of water only. She reported at the time sticking pretty much close to the whole food plant-based SOS-free diet. She did try a little bit more salt. She does have a little bit more oil. She mentioned to me she got into the Miyoko's cheese a little bit, so a little bit of processed food. And she did try wine a couple times, but she actually started to have a little bit of tenderness in her pelvic region and doesn't do it anymore. She does also do more intermittent fasting, where she will fast from 6 p.m. to usually right around 11:30, not every day, but most days. Patient arrived on November 29th, 2017. She had gained a little bit of weight. So she was at 69.5 kilograms, BMI of 25.5. At the end of the 19 days and appropriate refeeding time, she did lose weight, went down to 62.2 kilograms, a BMI of 28.8. So she did lose quite a bit of weight. And then the PET CT scan that was following that particular water fast in January of 2018 did show that the axillary and the inguinal lymph nodes were still, there's no evidence of active disease. We have just received the 6-year follow-up from the patient, and the great news is her PET CT scan in October of 2021 again showed actually no evidence of active disease. So she is still in remission. This is the 3-year follow-up. This is the one from 2018. And as you can see from the different images, it's going in order of appearance from left to right. It's the right axillary lymph node region, supraclavicular, and then the inguinal lymph node is the last slide there. There is quite a bit to close up, there is quite a bit of research and there is a great We have a brand new kind of site, www.fasting.org, but we do know based on the literature and the research we've conducted that water fasting under medical supervision is safe. We do know that water fasting definitely benefits reducing blood pressure, not only in just moderate, but also pretty severe hypertensive patients. Fasting with a vegetarian diet in rheumatoid arthritis patients does reduce inflammation and pain. And then we do know that fasting that complements chemo can actually help with reducing common side effects of chemo. And then one of the most recent research that we have released, which is exciting, is the water-only fasting followed by whole food plant-based diet definitely does reduce visceral adipose tissue, which we know is highly inflammatory. So there is good news there as well. So last bit is the, if the slide is going to go. Oh, the discussion. Last discussion of the night is, could there be another explanation for her results? And also a question to the panel, why might fasting be more effective in follicular lymphoma cases versus maybe other cancers? And then, you know, how many of these case or clinical case studies or even random control studies can we, you know, do we need to do before this is considered standard of care, which would be fantastic in follicular lymphoma. So I will give it over to the panel.
Thank you so much, Dr. Veress. That was wonderful. Dr. Goldhamer, your comments.
Yeah, well, we know that as much as 10% of patients with follicular lymphoma can go through periods of remission. So if you have, you know, obviously we need a clinical control trial that to really, you know, see how well this is going to work. And what we're trying to do right now is publish some of the many patients that we're following right now, which interestingly are consistently responding to this fasting. So both stage 3 and stage 4 lymphoma, we've got a number of patients right now that we've done. 2 recently were 40-day fast. We have 3 under care right now at the center that do seem to be responding. So we want to publish several case reports so we can justify a clinical trial, because I think a clinical trial will be effective at showing that this is an approach that can be done safely and effectively.
Oh, thank you. Dr. Klaper, your thoughts?
Well, could there be another explanation for her results? Again, the cynic would say spontaneous regression. These things sometimes they come and they go. And yes, that's why we need a clinical trial with sufficient numbers here of folks. And I guess half would be continuing with their standard Western diet, and half would undergo fasting and a whole food plant-based diet. But you have to follow these people along for 10, 20 years or more. You know, what happens to them? And there would have to be, you know, make sure they're histologically matched. The lymphomas come in all sorts of gradations and genetic dysfunction. And you need flow cytometry and all that to decide what kind of lymphomas you're looking at. But if you can gather up, you know, I'm not the statistician, 50, you know, 2 groups of, you know, 50 each, and follow them along for 10 years at least, you start getting some, you know, some data that would be certainly of guiding interest, we'll just say.
Mm-hmm.
And how many clinical studies, the more you get, the better. This is, you know, the early stages here. So the more studies in the larger subject field, the better.
Great. Thank you, Dr. Klaper. Dr. Breakey, any thoughts?
Yes. First, a couple of good questions, because I'm not the fasting expert. What kind of vitamin and or mineral supplements did you give during the fasting stage?
These are unsupplemented fasts.
Wow. Just plain distilled water.
Distilled water only, no supplementation up to 40 days. We don't go over 40 days usually.
Yeah. Okay. Thank you. So yes, as was mentioned by my esteemed colleagues, this could be spontaneous remission, and yet to go all the way away like that, I would think would be unusual. I see the data on how many, you know, just give 5-year survival versus all the way gone. But still obviously could happen. A lot of the research in this and many cancers is now going into what's called the microenvironment, and that is the host defense. And then, as again, I looked at this a little bit, they're finding differences here that are, I'm sure, are pertinent to our discussion, because those that have a more T cell response have a better prognosis than those with the macrophage response. And we know that T cells are influenced by not only microbiome, nutrition, and exercise, but these can be where and how we may be harnessing host defenses, because cancer, like infectious disease, is a battle between the immune system and the cancer to see who wins. And in this case, where we're flooding after the fasting state, flooding with whole plant-rich foods, rich in fiber that nourish the microbiome, that avoid the pro-inflammatories. You mentioned advanced glycation end products, trimethylamine oxide, heme iron, and the IGF stimulation from animal protein. We know that we're putting ourselves in a good microenvironment to attack, suppress that cancer with more smart bombs instead of just the indiscriminate chemotherapy that can affect everything. I think another piece in my mind that helps here is the lack of sugar. We know that cancer cells, that normal cells have mitochondria that can get, it's over 30 ATP per sugar molecule, but cancer cells can just split it and get just a small, and I think it's only 4. So they need a higher concentration. And I'd be interested in your studies about average blood glucose levels, hemoglobin A1C. I'm assuming that during the fasting stage, the average sugar levels drop, especially compared to a standard American diet where people are just flooding themselves and getting insulin resistance from the high fat content. And all that sugar allows the cancer cells to feed, grow, and extract energy from a higher amount, whereas limiting that glucose levels is relative starvation for cancer, but it's still allowing enough for the regular cells to survive since they can extract more energy per glucose molecule. So I don't know, just again, some general thoughts, recommendations on what we may be seeing and how we can apply this more broadly, hopefully to other cancers as well.
If I can just put a PS that the type of cancer I think makes a difference here, that we are dealing with lymphoma, and it's depending, it's a low grade, it's like your standard lymphocytes have gotten a little bit monstrous there, but the physical consistency of the tumor, it's a higher water content tumor, it's a more watery tumor, as opposed to some fibrous sarcoma or carcinoma with full of fibrous tissue there. Those I don't think would be so amenable to melting away on a water fast. But the lymphomas, leukemias, things that where the plasma and the extracellular fluid that's undergoing these chemical changes that are slightly more acidotic from the ketones and have lower sugar levels, et cetera, can penetrate into bathe the individual lymphoma cells and have more of a direct effect than some of these more fibrous and difficult tumors there. So as we're learning about this, the lymphomas, leukemias, et cetera, might be the better type of tumors to start with and learn more about the effect of fasting on the whole neoplastic process.
Dr. Goldhamer, you were smiling during some of my comments.
Well, we know that dietary excess is responsible not just for obesity and increased insulin resistance and diabetes and aggravating autoimmune diseases, and probably as a major risk factor for cancers of all types. So it's not shocking that fasting would be helpful at dealing with diseases associated with dietary excess. And I think the critical thing here is this patient was willing to comply, more or less, with a whole plant food SOS-free diet. And in our experience, patients that continue to do whole plant food SOS-free diets continue to manifest good results, whether it's diabetes or whether it's lymphoma or whether it's the other conditions, including hypertension that we treat routinely. The real challenge is getting compliance. And one of the benefits of fasting is it has many impacts, one of which is an effect on taste neuroadaptation. Patients like the taste of foods, healthy foods, better after fasting when they're addicted to artificial stimulation of sugar, oil, and salt in their diet. So it improves compliance. It also helps, you know, in this case, I explained to the patient that she needed to comply, that her life could depend on it, because if she didn't comply, I'd track her down and kill her. And she believed me. So, you know.
So yeah, interesting comments. Actually, as a moderator, I'm not supposed to interject here, but I do see some parallels here with prostate cancer, because there is that watchful waiting category, right? Which can, since the oncologists have stepped back anyway, and they're just looking at tumor size, if you can shrink the tumor using something else, I would think they would be thrilled.
Yeah.
So I guess right, and you can also imagine putting together a study where the safety is not really an issue, because you're just doing watchful waiting anyway, and all you're asking them to do is change their diet. So go ahead.
Yeah, that's important, because by reviewers at the BMJ, when this case was published, felt like, despite that it was radical, they guessed it was ethical because there really wasn't any treatment that was viable to offer anyway. So that was like, it was okay that we got her well, because we weren't displacing some conventional treatment that they had, you know, that they favored.
Sure, exactly.
And that's also one of the reasons why we talk about lymphoma, because it is a condition that's not considered unethical to help people recover from.
Although, Dr. Veress, didn't you say at the oncology visit they did recommend chemotherapy for her at that 2-year time? Again, just to clarify.
I didn't, Alan might know a little bit more regarding that. They did not, there's
Okay.
no notes in her study that show that they recommended it at that point in time. At the start of it, she had, I think this was the distinction, she had actually mentioned to her oncology team, she was not interested in chemo or radiation. And as we know, radiation was really not a component in this case. It's only really recommended for early stage. And so for her stages, chemo might have been recommended, but she's already mentioned she did not want to go down that conventional route. So that's where the oncology team had already said, okay, well then there is a component of watch and wait that she could do. So, and that was at that original 2014 visit.
This is where I'm wishing we had an oncologist here. Do you have any oncologists who support what you do or in this? I mean, have you gotten any oncologists who've been at all persuaded?
We have some patients that are oncologists that are sympathetic to what we do, but generally oncologists don't look at us with much favor, I would say.
Okay. And Bob, you were about to say something?
They discourage diet as a principal manipulative tool. I mean, that was very clear. Everybody she talked to, except for us, did not believe that dietary intervention was relevant at all.
Mm-hmm.
And I think from their perspective, you can understand where that comes from. They do have people out there that are trying to sell them things or programs or other that aren't really evidence-based or have much, and they can displace what could be at least improved therapies. The challenge, though, is that so often their therapies are trial and error too. And so many, and this, I'm talking more broadly in cancer, we don't know what's best. So you're going into a clinical trial, and then along comes something different. And, you know, as we talked about before, to get the numbers and the long-term follow-up necessary to really tell what is the best evidence for the best approach to a given cancer is often a challenge. And I guess my message to my patients is, hey, why not in any case, in any cancer, use this as an adjunct? There's no harm in, and I'm not talking about here about a 19-day fast, but no harm in at least going for whole food, plant-based lifestyle with the multiple benefits of decreased inflammation, less IGF stimulation. Why not give yourself every, and, you know, hey, if you're going to go with whatever treatment your oncologist recommends, you know, that's okay too. And yet I think that this case in particular illustrates one where we were better to better isolate. And Ted, as you mentioned, Dean Ornish did that too with early stage prostate cancer and had really quite remarkable results. And for for men in this early stage watchful waiting category. And the key thing that he found there was the epigenetics, the fact that the cancer promoting genes were switched off and the cancer inhibiting immune function genes were switched on. Over 500 genes were done. And I wonder if you studied that at all in your lymphoma patients or the ones that you've seen here. Have you looked at genetic markers to see whether these are influenced by either the fasting or your program?
Well, again, these are individual cases where we haven't detailed internal investigations. There are some other studies that we're doing that epigenetics is evaluated, and we've got a bunch of stuff coming up that hasn't been published yet. And some of those markers are on the list of pre-post considerations that we're looking at.
So
Excellent.
yeah, interesting. So we do have a question from the audience here. Do patients have to be a minimum weight or BMI before they undertake a fast? And do you monitor for refeeding syndrome, electrolytes, phosphorus, magnesium? When do you want to comment on that?
Yes, we definitely do. So one of the reasons why we do the refeeding protocol the way we do it is to prevent refeeding syndrome. And to date, and I think in the 37 years that Dr. Goldhamer has been doing this, we haven't had a refeeding syndrome case. And we do monitor, yes, various different electrolytes. We do monitor phosphorus, magnesium, if it's indicated for sure. Minimum fasting weight, usually we do like to have someone at least at the lowest like BMI, although in some situations, in very rare cases, if somebody is coming in with a pretty severe chronic illness that is that lends itself to fasting, we could even do a very short fast with them, even if they're at their 18% BMI. Obviously, we would not take somebody at that BMI to long-term fasting. So it's definitely weight does have a component. It doesn't preclude somebody from fasting even a short amount of time. I don't know if Dr. Goldhamer, you want to add?
In some cases, we've 21,000. We've been doing this for 39 years now, and certainly using this protocol, we've published a fasting safety protocol. There is a study people can look at. We took 5 years, all the patients, all the secondary effects, so that's been this protocol done safely and avoid refeeding syndrome, et cetera. And, again, 18 is a target, 16 is a bottom line, but sometimes a very thin person, short fast can be very helpful, probably because of its impact on microbiome and other related absorptive issues. So if you do short-term fasting with proper refeeding, you can then sometimes build people up that otherwise may not have been able to build up. So even in some cases, it's not obvious that would be the thing you'd want to do. There may be potential application, but generally it's nice to have people with adequate reserves so we don't run into depletion issues.
And what definition of a short fast?
A short fast would be anything more than the 16 hours of intermittent fasting we recommend for every patient every day. So anytime you get into the 1 or 2 or 3 or 5 day periods, that's what we would consider a short fast.
Right. And Dr. Klaper, it looked like you wanted to say something.
Yes, speaking of short fasts, this not directly attached to this case, but a place where short fasting is being utilized is the fact that in particular cancers, in particular chemotherapy regimens or radiotherapy regimens, it appears that the fasting state, if a person goes into their chemotherapy session on day 3 of a water fast, day 4 of a water fast, when they are in ketosis, remarkable things are happening, especially in their stem cells in their bone marrow. The stem cells with the lack of glucose and the ketones suddenly around, they go into kind of a hunkering down state. They stop dividing and they go into a state of protection and stability. Cancer cells can't do that. And so it makes them relatively more susceptible to the chemotherapy or to the radiation therapy. And so this is still in the infancy. We need, obviously lots of big studies with lots of patients showing this. But again, one could rationalize a woman signing up for breast cancer chemotherapy and maybe not even saying anything to the oncologist, but going in on day 3 of a water fast, I think should probably get a better response. And I don't think it would put her at any serious risk there. So watch this space. Fasting attached to conventional therapies, I think is going to be a very powerful adjunctive combination.
Yeah, Walter Longo published Journal of Metabolism in 2015 an article talking about differential stress sensitivity and differential stress resistance, just like Dr. Klaper said. Cancer cells are more vulnerable in the fasting state than healthy cells are. Their higher metabolic rate, their greater dependence on glucose puts them at a selective disadvantage. Chemotherapy works better and healthy cells are protected. That was done in rats, but they are now looking at people, and hopefully, that'll be investigated further and will become a routine treatment.
All right, thank you for that. We have another question here. Is there a refeeding sequence after a short or 12 to 16 hour or 24-hour fast? Do you have a refeeding sequence there?
Yeah, they go back on an exclusively whole plant food SOS-free diet.
Right. So at what point, how long does somebody have to be fasting before you cautiously refeed them?
Well, we always cautiously refeed everybody, regardless of whether they're fasting or they're feeding. But obviously, it's proportional to their reserves and how long they fast. Typically, you figure half the length of the fast for appropriate refeeding. So a person that fasts for 10 days needs a 5-day controlled refeeding period.
Right. Interesting.
Dr. Goldhamer, you mentioned the microbiome, and we know that diversity is important.
Yes.
You're depriving the person of food, but also the microbiota. Aren't
Yes.
they starving? How do they?
Yes.
How do
In
they
fact, we've
benefit?
done the first study on looking at this issue. We did stool samples before and after long-term fasting. We did it with Luigi Fontana from Washington University. We have not received the data from that study yet, as of yet. But what we do know from the existing literature is there's a big die-off. There's a big reduction, and the theory is it's like rebooting the hard drive on a computer. And then when you go back and feed all these soluble fibers that favor the type of diverse microbiome that we think is helpful, you get a chance to reboot and selectively compete with some of the bacteria that are thought not to be as health promoting, more associated with animal-based diets, et cetera. So we think of it like rebooting the hard drive on a computer. We don't exactly understand what might be going on yet. And when I asked Dr. Fontana, where's our data? He said, be patient, it's complicated because you're dealing with at least 1,000 strains of organisms. And we don't know exactly what the heck is really going on there. And we certainly don't know yet exactly what's happening in fasting, but it is something we're actively interested in and we expect to continue to study.
Very good. Well, we are reaching the end of our hour here. We have another question from Dr. Sunderman. When the patient gained weight in 2017 and consumed some processed vegan food, salt, sugar, et cetera, did she have a scan at that time that showed any change in her lymph nodes?
No, the scan she had was in 2016 was the last one. And then she came in for a fast. The follow-up scan was in 2018. So she didn't have one in between that time.
Got it. All right. Well, listen, thank you all so much for presenting this fascinating case. It's been really enjoyable. Before we sign off, I just want to mention that we'll be doing this again next month. What day is that? That's going to be Tuesday. Somebody help me out. I'm looking right here. It's Tuesday, March 15th at 7:30. And that'll be Dr. Carrie Graff will be presenting a case. She is the head of lifestyle medicine at Rochester Regional Health System. Dr. Megan Greger will be our guest panelist. Dr. Greger is very active in the American College of Lifestyle Medicine. She's been in charge of a couple of the previous conferences, annual conferences. So really excited to hear what they have to say. And of course, we'll have Dr. Breakey again and Dr. Sunderman, who was in the gallery this time. And any other comments before we sign off, everybody? Nope. All right. Well, listen, one more little announcement. For those of you who are interested in the LIFT project, there is a LIFT project starting tomorrow night for ACLM members, American College of Lifestyle Medicine members. And go to our website. You can find out what the LIFT project is all about. It's all about raising people's moods through positive psychology, which is part of lifestyle medicine and part of the joy of what we do. So again, Dr. Veress, thank you so much for a terrific case.
Thank you.
Yeah. Dr. Klaper, thank you for making another cameo appearance. We always love to see you. Dr. Goldhamer, thank you so much. And Dr. Breakey, thank you again. We'll see you next month.
All right. Thank you.
Thank you.
Great job.
Thank you. Well done.
All right.
Go spread some health.
Good night, everybody.